Early diagnosis and treatment of familial hypercholesterolemia. This presentation was designed to educate you on familial hypercholesterolemia. FH is a genetic disorder that goes undiagnosed in many people. Today, we hope to shine a light on this disease. We will share with you how it is developed, common signs and symptoms, how it is treated, and most importantly, how it is diagnosed. Early detection of FH can help save countless lives. Familial hypercholesterolemia is a genetic disorder that is caused by a gene mutation. It is characterized by extremely elevated LDL cholesterol levels. Patients with FH are unable to break down and remove cholesterol from the body. Because of this, it will build up in the arteries. While this condition is not curable, it is treatable. Unfortunately, most people with FH go undiagnosed. FH can lead to premature atherosclerotic cardiovascular disease, and that can lead to MI or stroke. There are more than 2,000 genetic mutations that cause familial hypercholesterolemia, but in about 30% of cases, the cause is unknown. There are two types of FH. The first is heterozygous FH, where a gene mutation is inherited from one parent. In homozygous FH, the same mutated gene is inherited from both parents. In the United States, it is estimated that between 600,000 and 1.5 million people have FH, but only 10% of these have been diagnosed. Many patients won't exhibit signs and symptoms of FH until the disease has progressed. This disease is treatable, but in order for patients to seek treatment, they need to be diagnosed. It is more crucial than ever that we educate patients with FH to encourage their families to begin cascade screening.
Clinical presentation. Some clinical presentations of FH include tendon xanthomas, xantholysomas, and premature coronary arcus. We added visuals on how these clinical presentations look on the next slide. One of the main signs of FH is LDL cholesterol levels over 190 in adults and over 160 in children. LDL cholesterol levels should be less than 100, so this can be an issue. This contributes to atherosclerotic plaques, which leads to a higher than normal risk of coronary heart disease. If left untreated, people with FH have 20 times the risk of developing heart disease. Diagnostic screening. Screening for elevated cholesterol levels should occur between ages 9 and 11. It should begin at age 2 for those with a family history of elevated cholesterol, but no sooner because lipoprotein levels are unstable. This is another reason why screening is not recommended during adolescence. Puberty causes LDL-C levels to become unstable, which can lead to faulty test results. Like with many diseases, early screening offers the best benefit for patients as that can allow them to implement treatment that is specific to the disease process. For FH specifically, it can prevent lifelong exposure to elevated low-density lipoprotein and cholesterol levels. Diagnosis. An FH diagnosis is based on lipid levels, family history, genetic analysis, and/or physical exam findings. The lipid test measures the amount of LDL cholesterol in the blood, and genetic analysis detects a pathological mutation which accounts for the elevated levels. Tools. There are 3 tools that assist and aid to the clinical diagnosis of FH: the Simon Broom Register, the Dutch Lipid Clinical Network Criteria, and Make Early Diagnosis to Prevent Early Death program. Genetic testing. There are several factors that prevent routine genetic testing in the United States. The main ones are the high cost. It can be upwards to $2,000, and the lack of insurance coverage. When possible, genetic testing finds a mutation causing FH in about 60% to 80% of people thought to have FH. But there are some mutations that cause FH that remain unknown, so it is not a guarantee that you will get diagnosed with FH if you do have FH. Treatments. Lifestyle changes is the first option discussed. Sadia will talk more about that later on. Statins, combination drug therapy, and apheresis are used. There is also surgical therapy, and the main surgery done is partial ileal bypass.
For our nursing considerations, we're going to start with cascade screening. This is a key consideration because familial hypercholesterolemia is an inherited genetic condition. Cascade screening for familial hypercholesterolemia includes active monitoring of cholesterol levels and genetic testing. If familial hypercholesterolemia is diagnosed, the family members of the affected individual will also be asked to undergo testing. Although manifestations of familial hypercholesteremia do not occur until later in life, early screening can help in management before symptoms can occur. First-degree relatives of affected individuals have a 50% chance of having familial hypercholesteremia. Second-degree family members have a 25% chance, and third-degree family members have a 12.5% chance. Our next nursing consideration is patient education. The first key point that we want patients to know about familial hypercholesteremia is that family members of affected individuals should be screened for this condition. The second key point in patient education is maintaining a healthy lifestyle. Things such as eating healthy, getting plenty of exercise, and avoiding smoking or excessive drinking can greatly reduce the complications involved with familial hypercholesteremia. The third key point is that uncomplicated familial hypercholesteremia is able to be easily managed by a primary care provider. Patients who develop severe familial hypercholesteremia may have to see a lipid specialist who can help better identify how to best manage this condition for each specific patient.
The nursing diagnosis we chose is knowledge deficit concerning high cholesterol. So nowadays, it's not a surprise that most people are not knowledgeable about how concerning high cholesterol really is. Therefore, it is the responsibility of the nurse or the doctor to keep the patient informed of the possible complications and what to do to comply with it to log in the quality of life. The Caritas we chose is promoting interpersonal teaching and learning. The caring science theory was created by Gene Watson, in which approaches a patient with art and science of nursing. This kind of holistic approach encompasses a caring, healing environment. What Gene Watson's particular theory means to me is to teach the patient to reach an overall high level of health. This caring approach highlights the importance of Watson's philosophy and science of caring. I was able to relate this on a personal level because I remember when my grandma got diagnosed with high cholesterol, she did not have much knowledge. But after the nurse and doctors educated her, she was able to manage it. With the use of Caritas, the doctors were able to build an interpersonal relationship with her through the use of teaching. And with the use of exercise and diet, patients are able to manage their high cholesterol and increase their quality of life. Educating a patient to exercise is very important because it increases the high-density lipoprotein. It's important to increase HDL levels in those who have high cholesterol because it absorbs cholesterol and carries it back to the liver, which eventually flushes out in the body. Lastly, teaching and providing a diet plan to the patient with familial hypercholesterolemia, it's important to keep the cholesterol levels controlled. Teach patients to limit saturated fat and trans fat. Encourage patients to consume a high fiber intake, increase vegetable, fruit, beans, and lean meat. The nursing diagnosis we went with is inability to adapt to a change in health status. Without a doubt, food is an important part of culture because it is what preserves the culture no matter where the person is. However, majority of the time the food isn't always good for our health. It adds an inch or two to our waist and instantly gives us hypertension. Okay, I am over-exaggerating, but it is a reality of things. The theory of Caritas created by Gene Watson was designed to cure patients' overall health instead of focusing solely on the diagnosis. This allows nurses to approach patients with a spiritual practice while creating a healing environment. We chose the Gene Watson's theory of cultivation of sensitivity to oneself and others because it's important to be considerate of the patient's culture. I'm also able to relate this Carita to the story that I said earlier because when my grandma was going through the whole process of getting treated, I remember doctors took her culture into consideration when creating the plan of care. When healthcare professionals take culture into consideration and incorporate into the plan of care, patients feel comfortable and are willing to cope to better their overall state of health. The research paper written by Elkins and Firth highlight that North America is one of the 2 countries that have higher prevalence in familial hypercholesteremia. The reason behind it has to do with all the factory processed food consumers can purchase at the local grocery stores. These foods are packed with saturated fats that skyrocket LDL levels. Medical professionals have to be considerate of the patient's culture and plan a diet change with the patient to prevent heart disease. People can still eat soul food, of course, but of course in moderation.
Thank you for taking the time to watch our presentation. We hope you enjoyed learning about familial hypercholesterolemia.